ready down there, Mr. Larson? Yeah, good. Right on. Okay, folks, we'll convene the Standing Committee on Public Accounts. I'll recognize the committee members that are here today. Deputy Chair, Mr. Hugh Nerline, Mr. Todd Gowdy, Ms. Lisa Lambert, Mr. Delbert Kirsch, Mr. Darrell Harrison, and Mr. Jim Lemeg, and Ms. Alina Young. I'd like to welcome and introduce our officials from the Provincial Comptroller's Office. We have Jane Borland, Assistant Provincial Comptroller, and Gabe Plosker, Manager. Thank you very much for being here. I'd like to welcome and introduce our Provincial Auditor, Tara Clement, and the officials from the Provincial Auditor's Office. Thanks for joining us here today. We have the following documents to table here today. PAC 131-29, Ministry of Finance Report of Public Losses, October 1st, 2023 to December 31st, 2023. PAC 132-29, Ministry of Finance Responses to Questions Raised at the February 5th, 2024 meeting. And at this time, I'd like to welcome the good folks from the Ministry of Corrections and Policing and Public Safety. I'd welcome Deputy Minister Larson here today and all the officials that have joined us here today. Thanks for your work. Thanks for being here. I'll kick it over to Deputy Minister Larson to briefly introduce the officials that have joined him here today. Refrain from getting into the comments on the chapters at this time. We'll then turn it over to the auditor and come back to you for subsequent comments. Deputy Minister Larson.
Good morning, and thank you, Mr. Chair. Other committee members, Provincial Auditor and her team, and Provincial Comptroller team. Before I introduce my team, accompanying me today, I would like to thank the Provincial Auditor and her team for their work on the Ministry's performance audits. Today, with me on my leadership team are from Custody Service, Mark McFadden, Lindsay Tokorski, Bryce DeJong, and from Supervision and Rehabilitation Services, Carolyn Davis and Carolyn Graves and Dean Carey. Thank you.
Thank you very much. Thanks to everyone in attendance. I just remind any officials that are coming to the microphone beyond Deputy Minister Larson to say their name, to identify who you are before you present to the committee. I will now turn it over to our Provincial Auditor to focus on, sorry, Deputy Minister Larson.
Not to say that he is no longer part of my executive leadership team, but he was with us when he had PDAP with the ministry and now with SPSA. Noel McAvina is Executive Director. Thank you.
Thank you very much. I'll turn it over to our Provincial Auditor to make presentation. We're going to focus on the first chapter there with the new recommendations, then we'll turn it back your way.
So thank you, Mr. Chair, Deputy Chair, members of the committee and officials. With me today is Mr. Victor Schwab. He's the Deputy Provincial Auditor that is responsible for the Ministry of Corrections, Policing and Public Safety. Behind us as well is Mrs. Michelle Lindenbach. She's our liaison with this committee. She's a principal in our office and would have been involved in a number of audits that are before us in terms of the ministry discussion today. Victor's going to present the 4 chapters with regards to the ministry in the order on the agenda as they do appear. We will pause after every presentation for the committee's consideration. There is 1 new performance audit, which includes 7 new recommendations for the committee's consideration, and then 3 follow-up audits. I do want to thank the Deputy Minister and his staff for the cooperation that was extended to us during the course of our work. With that, I'll turn it over to Victor.
Thank you. Chapter 8 of our 2022 report, Volume 2, on pages 55 to 73, reports the results of our audit of the Ministry of Corrections, Policing and Public Safety's processes up to May 31st, 2022, processes to administratively segregate inmates in its adult secure custody correctional centers. Administrative segregation is used in correctional centers to keep an inmate away from the general population for safety or security reasons. The audit did not examine disciplinary segregation as the processes varied between the 2 types of segregation, and we consider administrative to be higher risk. This chapter includes 7 new recommendations. The Ministry of Corrections, Policing and Public Safety provides inmate care, control, and supervision for inmates in 4 provincial correctional centers located in Saskatoon, Regina, and 2 in Prince Albert. Effective processes to administratively segregate inmates contributes to the safety and well-being of inmates, staff, and the public. Unnecessary or prolonged segregation may leave vulnerable inmates with lasting mental and physical health damage, and in extreme cases, loss of life due to suicide. In 2021, the ministry had 54 placements of 49 inmates on administrative segregation, compared to 75 placements in 2020. Good practice suggests that inmates should not be subject to administrative segregation placement for longer than 15 days. Between January 2021 and April 2022, we found 13 inmates who were on administrative segregation greater than 15 days, ranging between 16 and 43 days. Now I will focus on the 7 recommendations. In our first recommendation on page 60, we recommend the Ministry of Corrections, Policing and Public Safety develop a training plan to regularly provide refresher training to correctional center staff involved in administrative segregation. Upon hiring, the ministry provides all new correctional center staff 11 weeks of training, which includes a module on administrative segregation. But we found the module on administrative segregation to be outdated. For example, it notes placement reviews are required every 21 days instead of 14 days, which is the current requirement. During the audit, we found the ministry did not provide correctional center staff refresher training on administrative segregation processes after orientation. In June 2022, the ministry provided refresher training on administrative segregation processes to correctional center managers at 3 of the 4 correctional centers and expected to complete the 4th center by September 2022. This training covered the new processes in the ministry's August 2022 revised policy. We found the ministry did not provide this training to correctional officers or nursing staff. Not providing regular refresher training to those involved in administrative segregation processes increases the risk of inmates being inappropriately placed on administrative segregation, which could affect the health and well-being of those inmates. In our second recommendation, on page 62, we recommend the Ministry of Corrections, Policing and Public Safety have appropriate correctional center staff authorize administrative segregation placement decisions. The ministry does not always properly complete assessments and approve decisions for inmates placed on administrative segregation. The ministry requires correctional center managers to complete an assessment prior to placing an inmate on administrative segregation or within 24 hours of placement. We tested 20 inmate files and found 3 assessments were completed by inappropriate staff. Correctional officers completed the assessment rather than the appropriate correctional center manager. We also found 1 assessment did not document the rationale for placing the inmate on administrative segregation or if alternatives were considered. Moreover, we could not confirm whether the assessments of 6 inmate files were properly completed and inmate placements were justified, as the ministry was unable to provide us with those 6 assessments. Management indicated this was due to a lack of a centralized location to keep completed assessments. We also found 5 inmate placements on administrative segregation were not properly authorized. In all cases, a correctional officer approved the placement decision instead of the correctional center manager. Not having appropriate staff completing and approving administrative segregation placement decisions increases the risk that inmates may be placed on administrative segregation inappropriately. In our third recommendation on page 63, we recommend the Ministry of Corrections, Policing and Public Safety follow its policy requirements for inmates placed on administrative segregation. Correctional center staff do not always complete administrative segregation reviews and health care assessments as required in the administrative segregation policy. The ministry have set specific requirements for various reviews and assessments in its administrative segregation policy. However, we found correctional center staff were not always following the policy. For example, inmates are supposed to receive 2 hours of cell out-of-cell leisure time each day, but we could not confirm this occurred as expected in many instances because staff did not follow policy and document their daily observations and meetings with inmates through daily reviews. Also, we found nurses are supposed to complete periodic healthcare assessments to evaluate each inmate's mental and physical ability to cope with segregation and make written recommendations about an inmate's placement on administrative segregation. But this is not always happening as required, or were being completed late. Not completing healthcare assessments increases the risk that inmates already suffering from mental illness may find their medical conditions deteriorate further while on administrative segregation. We also found the ministry did not always carry out longer-term reviews of inmates placed on administrative segregation. These are required after 7 days and after 14 days. To increase the likelihood correctional center staff follow administrative segregation policy requirements, the ministry should provide regular refresher training on administrative segregation processes. We also recommended the ministry enhance its regular quality assurance reviews and provide feedback to the correctional centers on non-compliance with the policy, which is our fifth audit recommendation I will touch on shortly. In our fourth recommendation on page 69, we recommend the Ministry of Corrections, Policing and Public Safety have appeals by inmates placed on administrative segregation reviewed by independent adjudicators. The ministry maintains an appeal process for inmates placed on administrative segregation. However, it does not align with good practice. Good practice recommends an independent adjudicator, such as ministry staff or other correctional center staff that are external to the correctional center, make the appeal decision. Current legislation requires the director of the relevant correctional center to make the decision on the appeal. Having an independent adjudicator make the appeal decisions could help to ensure fair oversight and reduce the risk of biased decisions. In our fifth recommendation on page 70, we recommend the Ministry of Corrections, Policing and Public Safety broaden its administrative segregation quality assurance processes to include assessment of all key policy requirements. The ministry maintains a quality assurance process to monitor compliance with administrative segregation legal and policy requirements. However, improvements are needed. The ministry's Director of Standards and Compliance is responsible for the quality assurance processes around administrative segregation. However, we found the quality assurance process is not covering all key policy requirements. For example, the director does not review whether correctional center staff complete healthcare assessments or daily reviews as required. The quality assurance processes should also assess whether inmates sign off that they were notified of their placement decision. Not reviewing all key policy requirements during the administrative segregation quality assurance process increases the risk that the quality assurance reviews may not identify key areas for improvement. In our sixth recommendation on page 72, we recommend the Ministry of Corrections, Policing and Public Safety enhance its written report to senior management about the use of administrative segregation in its adult secure custody correctional centers. The ministry reports the results of its quality assurance reviews to senior management. However, the report should include more information and analysis. We found each year senior management receives a report that includes statistics on inmates placed on administrative segregation. The report includes 3-year trend information and some analysis. The ministry also reports the reason why inmates are placed on administrative segregation and the results from the quality assurance reviews with a comparison to the results from the 2 previous years. However, the report does not indicate whether reviews were conducted late or documented properly. This would be key information for the ministry to also monitor. We think the ministry could enhance its written reports to senior management by including detailed information on the number of inmates placed on administrative segregation for more than 15 days, analysis of the required reviews and quality assurance results, and reporting and analysis of inmate appeals as recommended by good practice. Having more information and analysis on its administrative segregation processes would help senior management identify issues with the use of administrative segregation that need to be addressed. Also on page 72, our 7th recommendation, we recommend the Ministry of Corrections, Policing and Public Safety report key information about the use of administrative segregation. The Ministry does not report information about the use of administrative segregation to the public. We found other jurisdictions publicly report some information on administrative segregation on their government websites. For example, both Yukon and Ontario include the number of placements on administrative segregation, the length of stay, and some demographic information about the inmates. Public reporting information about the use of administrative segregation would help the ministry demonstrate its commitment to reducing the overuse of segregation, enhance accountability, and promote oversight. I will now pause for the committee's consideration of this chapter.
Thank you very much for the presentation, the focus of the chapter. Thanks as well to the ministry for their work on these fronts and the status update they've provided. I'll table that status update at this point. Document PAC 13329, Ministry of Corrections, Policing and Public Safety, status update dated February 26, 2024. I'll kick it over to Deputy Minister Larson to respond briefly to the recommendations or the chapter, and then we'll open it up for questions.
Thank you, Mr. Chair. The ministry appreciates the work completed by the provincial auditor team on this chapter and is pleased with the progress we have made to address the auditor's recommendations. From our position, 5 of the recommendations have been achieved. I'll turn it over now to Mark for comments regarding actions taken by the ministry thus far to address the recommendations. Thank you.
Good morning and thank you. Mark McFadden, Executive Director of Custody Services. I'll go over our status summary for the committee, and then we can get into comments and questions after that, if that's okay. Regarding recommendation number 1, noted on page 60, relating to the developing a training plan to regularly provide refresher training to correctional staff involved in administrative segregation, the ministry considers this recommendation implemented. Correctional facility managers completed refresher training in May of 2023. New e-learn modules were implemented in November 2023 as well. This training will be taken by all correctional officers, nurses, and correctional facility managers by April 2024. Staff will be required to complete the module every 3 years. Worth mentioning, new staff are required to take training on administrative segregation as part of the ministry's induction training program. Regarding recommendation number 2, noted on page 62, relating to the authorization of administrative segregation placement decisions, the ministry also considers this recommendation implemented. The quality assurance tracking sheet was updated in December 2022 to include a number of details around authorization. The Director of Standards and Compliance, Lindsay Tokarski, also reviews our criminal justice information management system at least weekly regarding placements to ensure requirements are met, and then annually to ensure all paper documentation is signed by the correctional facility manager and inmate. Regarding recommendation number 3, noted on page 63, relating to the ministry adhering to its policy, the ministry considers this recommendation partially implemented. The quality assurance tracking sheet was updated in December 2022 to include whether all reviews and healthcare assessments are completed on time. Beyond the Director of Standards and Compliance monitoring activity, we will be requiring correctional facility directors to also monitor placements in their facilities. We expect this latter portion to be executed later this spring. Regarding recommendation number 4, noted on page 69, relating to the independent adjudicator reviewing appeals by inmates placed on administrative segregation, the ministry considers this recommendation not implemented and is currently researching this further. Regarding recommendation number 5, noted on page 70, relating to the ministry expanding coverage of its quality assurance process, the ministry considers this recommendation implemented. As you've already heard, we updated our quality assurance tracking sheet in December 2022, and this is including added a number of items to cover key policy requirements. Regarding recommendation number 6, noted on page 72, relating to the ministry enhancing reporting to senior management about the use of administrative segregation, the ministry considers this recommendation implemented. Reporting to the senior management was expanded in February 2023 to include detailed information on all inmates placed on administrative segregation, analysis of the required reviews and quality assurance results, example, whether correctional center staff properly completed the reviews on time, and reporting and analysis of inmate appeals as recommended by good practice. And finally, regarding recommendation number 7, noted on page 72, relating to the ministry publicly reporting key information about the use of administrative segregation, the ministry considers this recommendation implemented. About a year ago, through the Publication Center, the ministry started disclosing statistics on administrative segregation administrative segregation use that aligns with what other jurisdictions have equally reported. This reporting will be updated annually. That concludes my status update. We have Lindsay Tokarski, Director of Standards and Compliance, joining us this morning as well. We'll open the committee for questions or comments, and thank you.
Okay, well, thanks so much. Thanks for the work on these fronts. Thanks for the presentation. I'll open it up now to committee members for questions. Ms. Young?
Good morning. Thanks so much for being here today. How many people were placed in administrative segregation for the year 2022-2023?
Good morning. I'm Lindsay Tokarski, Director of Standards and Compliance. So in 2023, there was 12 placements of 10 inmates. And in 2022, there was 44 placements of 40 inmates.
Thank you. Do you know how many inmates are in administrative segregation currently?
As of today, 0.
Thank you. Currently, what's the average length of stay?
For 2023, the average length of stay was 5.75 days.
And what's the length of the current longest stay?
The current longest was in the 11 to 15 days range, but I believe it was 14 days for 2023.
Thank you. And do you have the reason for that placement?
We have a 15-day cap on the use of administrative segregation.
Me?
We have a 15-day cap on the use of administrative segregation.
For sure. But the initial reason for that placement of, I believe you said 14 days.
I don't have that information today for that specific placement, but we can get that to you.
Thank you.
Thanks for the undertaking to get the information back. Thanks for that undertaking. Just for consistency, any undertakings to provide back, is it reasonable to have that information within a 4-week period, a 1-month period, and that can come through the clerk and supplied back to the committee? Thank you very much.
That's specific to the one instance, the 14-day one? Okay, perfect.
In relation to the e-learn modules that were developed around administrative segregation for staff, I see that these were implemented in November 2023 according to the status update. At that point in time, how many staff were required to take these? Like, what was the outstanding number of people required to take training?
So the training modules, we have separate ones for correctional facility managers, correctional officers, and also nurses. You're asking for the completion rates? I don't have that at the moment.
Okay, thanks.
We have our staff numbers, though.
Okay. Happy to get that today or at a future date if that information is available.
Sorry, did you want the staff numbers or do you want it all in one?
All at once is great, yeah.
Okay.
Thank you. And just to be clear, that'll include kind of up to date in terms of the number of staff who've taken the training thus far, with the targeted completion date being April 2024 for all staff, correct? Okay, great. Thank you. And just To clarify, the staff are required to complete that refresher training every 3 years, and that 3-year window started November 2024.
It will start at April 2024.
Okay, so the end of that 3-year window then would be expected to be April 2027. Okay. Thank you. Moving on to some questions. Actually, one broad question. Looking at this in terms of the training and the rates of current training for staff where you started and where you are today, how, I'm not sure, forgive me if this is a question for you or perhaps for the auditors, how Saskatchewan compared to other jurisdictions? Is this an area that we see other jurisdictions looking to come up to speed with their training, or is this something unique to Saskatchewan in terms of the numbers?
So I don't think this would be unique. This is no different with any type of agency where you have, I guess, critical processes. It's about staying current with good practice. So our expectation was really with those staff that are almost involved, obviously, in the various administrative segregation, that there would be that ongoing training. So this would be consistent with, recommendations auditors make in other jurisdictions as well. It was, I think, it's about frequency, right? And it is about comprehensiveness. And it sounds like the ministry is moving in a direction where the people that are involved in this very important process will be apprised of and continue to obtain that training on a regular basis.
Thank you. And the use of administrative segregation in Saskatchewan, is that consistent with what we would see in other jurisdictions, or is it higher, is it lower?
Yeah, I'm not sure that we have, it is a practice that is used elsewhere as well. I think what we basically were concerned with was the concept of the good practice being that 15 days. So there is, and probably in our sort of references, there was work done in other jurisdictions, and it really comes down to making sure you have a good process to make those decisions, and then the length of time monitoring then when those inmates are in those situations, and then also just the length of time in which they are placed on such segregation leave.
Thank you. Moving on to the second of the auditor's recommendations. Currently, who among the correctional center staff now has the authority to authorize administrative segregation placement decisions? Is it currently the manager?
Correctional facility managers.
Perfect. And the ministry's like fully compliant with that recommendation?
Yes, our review in 2023 showed that 100% of placements were authorized by a correctional facility manager.
Okay, great. So as of 2022, 2023, there haven't been any deviations from that?
No.
Excellent, thank you. Moving on to recommendation number 3, and seeing the work undertaken by the ministry to implement the auditor's recommendation. For 22-23, did staff complete all reviews, including healthcare assessments of segregated placement decisions, on time? 7-day, 14-day.
So 92% of the initial placement reviews were completed, and 100% of the 7-day and the 100% of the 14-day were also completed.
Thank you. And were there any physical or mental health related incidents amongst individuals in segregated placement in either 2022 or 2023?
Could you be a little more specific, please?
Sure. In 2022, 2023, were there any incidents of physical or mental health identified through these healthcare assessments of segregated inmates?
I don't have the individual healthcare assessments, and also the inmate's health information is protected by HIPAA, so I will have to take a look into that for you.
Sure, and just to clarify, I'm not asking, and forgive me if I'm treading where I'm not supposed to. I'm not asking for like necessarily individual information, but just more broadly speaking, you know, if there were incidents of physical or mental distress experienced by inmates in aggregate, it'd be great to know that.
I'll have to take a review of the healthcare assessments and let you know.
Perfect. Yeah, if that information is available for 2022 and 2023, it would be appreciated. And I guess one last question on that point, if that information is available, again, not asking for any individual specific health information, but if there are broader trends or causes that can be identified, whether it's physical, whether it's related to illness, whether it's related to, you know, self-injury or mental health, kind of at that higher level, that would be also appreciated. Looking at the quality assurance tracking sheet, which was updated and is being used by the ministry currently, it's noted in the status update that at a minimum, the quality assurance tracking sheet is updated weekly. Is this an effective process?
I believe so, yes.
Thanks. Under the planned actions, it notes that directors will now have the added responsibility for monitoring placements in their facilities. Is this something that is going to be manageable for directors? Are there any concerns about increased administrative burden or reporting?
No, our numbers have steadily declined since 2019 when we started tracking. So, like, for example, last year there was only 12 placements of 10 inmates. So I think it'll be definitely manageable.
Thanks. And you noted that the numbers have declined since you started tracking, and I noted there was obviously a fairly steep decline in numbers over the past 5 years. Is that attributable to just the very practice of tracking these placements and being more aware of it and ensuring that there is proper documentation happening, or what do you attribute that steady decline to?
I would say it would be, there's a number of processes, the enhanced review process, where it's daily, weekly, every 14 days. There's also, what was the other one? The administrative segregation assessment tool. So it standardized the assessment of it. So there's a risk assessment and also the consideration of reasonable alternatives. So that was also very important. And I think also the refresher training that was provided, and also the hard work done by the facilities. They've really embraced the changes.
Thank you. Looking at that and taking into consideration all of these workplace changes as well as some new reporting requirements, have there been any concerns expressed by staff in correction facilities about any of these like increased administrative burdens or reporting requirements placed on them?
No.
Thank you. And sorry, can you remind me, what's the current number of FTEs in the ministry?
In custody services. Okay.
Forgive me.
Yeah. $152. Okay.
Thank you. And does that number, not having the past 5 years in front of me, does that represent an increase, a decrease, or fairly steady?
I would say that it's fairly steady. It might vary a little bit year to year, but not drastically.
Thank you. And with some of the actions taken to implement the provincial auditor's reports, have there been increased training dollars or things like that allocated?
Would not be something that is tracked. We see the training as something that's obviously required at the facilities, and the training is just completed. We don't have a separate line item for that.
So staff complete that during their regular work hours. It's there's not like a need to bring in kind of coverage or anything like that.
Certainly there is, and that's part of the extra cost of training in a correctional facilities, right? That those people that are attending that training for that day would have to be backfilled accordingly, and so there's lots of variables that come into play there.
And do you have a cost associated with that?
An all overtime cost?
Yes, specifically for this chapter.
We wouldn't have it for today's discussion, but we could get that for you.
Thank you.
Okay.
One of the reasons why we're some of the e-learn modules is so that the employees can do it, kind of work it into their daily shift, taking them so that we don't have to rely on so much of, people coming in on days off and things like that. So to hopefully bring the, costs associated with training specific to this or even other things more cost neutral.
Thank you. Looking at recommendation number 4, which is the outstanding recommendation not implemented, and the timeline for implementation is kind of TBD, with the acknowledgement that the ministry is currently researching best practices. Can you speak to the lack of progress on that recommendation?
Yeah, I don't know if it's lack of progress, but it requires legislative changes. So we have some front-end work to do that we need to prepare some documents and briefing materials for not only the deputy, but the deputy then to the minister and for their review. And it could be, when we're changing legislation, from our experience, it could take like a multi-year type activity.
Is there an expected timeline? Is this something that's being prioritized in terms of the work of?
We would expect, at least from our end, to have the information available to our deputy and our minister's office this fiscal prior to December of next year.
Thank you, and appreciating the work that goes into legislative changes. And that sometimes that can be a bit of a lagging indicator for practice and policy. Are there other areas that the ministry is aware of where they're not compliant with either existing legislation, or they're looking to make important changes like this to the current acts?
Yeah, and I don't think it's a compliance piece. It's more of a timely piece that we've identified some changes that need to be made. And aside from admin seg, we recently had an audit report done by Ombudsman Saskatchewan in regards to discipline. So there's some pieces in our discipline segregation package that if we're going through one, we want to go through other. We kind of want to do this exercise once and capture not only recommended practices, but also some things operationally that we've identified over the years that we'd like to make some changes on.
Thank you. Moving on to recommendation number 5. The actions taken to implement since the provincial auditors report the status update notes that the quality assurance tracking sheet was updated December 2022 to ensure it covers off all key policy requirements. And going through those 5 bullet points listed on the status update, the first one, it notes that should be confirming inmates are signing off on placement decisions. Someone with no real experience with corrections, do inmates have the ability not to sign off on a placement decision?
Yes, they can choose not to. In that case, it would be signed by 2 staff to indicate that the inmate did not want to sign.
And are there any consequences, like administratively, for the ministry or the facility or for the inmate in question?
No.
Where it notes there's an emphasis placed on providing feedback to the correctional centers on non-compliance with the policy. Can you speak a little bit more about what that feedback mechanism or content could look like?
Well, if I notice any deficiencies, then I will either call or email the director, explain what the deficiency was, and then get confirmation that they've received that, and we'll correct it.
Thank you. What does the process look like? Obviously, the hope would be that's corrected right away, and I imagine in the vast majority of cases, it almost exclusively is. What does the process look like for escalation if you have to go back for perhaps round 2 or round 3?
Oh, I would definitely check again, but the directors are very receptive to feedback in this area, so I haven't run into an instance where it hasn't been understood, the error that was made.
Great, thank you. And I guess same questions in regards to the healthcare assessments. If these aren't completed, what does that process look like for kind of accountability and compliance?
So I would again return to the director, who would speak with a nurse manager, who would discuss that with the nurses that were on shift that day who should have completed such a thing.
Thank you. And similarly for if the daily reviews are being completed or not. Okay. Do you have the numbers available, or percentages for how compliant the institutions currently are with these requirements?
For the review requirements?
Yes. The quality assurance tracking that you're doing as a key measure and deliverable for this.
So as I mentioned before, the review indicated that there was 92% of initial placement reviews that were completed and completed on time, 100% of 7-day reviews, 100% of 14-day reviews. The daily reviews were partially completed in 70% of cases, so there may have been 1 or 2 missing. And then 67% had the healthcare assessment done.
Thank you. And remind me the time period for that healthcare assessment?
So for the initial placement, it's within 24 hours. If there's one that needs to be completed for the 7-day review, meaning the placement is continuing on past the 7 days, it's either the day before or the day of that review.
Thank you. So that 67% number you just referenced is related to which measure?
That would be the healthcare assessments.
Okay. For the initial healthcare assessments?
For both.
For both. Okay. So moving on to recommendation number 6, it's the status update speaks to the fact that reports are being prepared for senior management of the correctional centers regarding administrative segregation, and these reports are being, there is publicly accessible information on this as well. Looking at whatever analysis is taking place of the required reviews and quality assurance results and the reporting and analysis that's going on, would you characterize this as a positive process? Are there positive results emerging from this, both for the institutions and the inmates in question?
Yes, for sure. Every year there's market improvement over the previous year's numbers or statistics. So, yeah.
Could you speak to how you'd characterize improvement?
So there's improvement in like the number of placements and the number of inmates that has steadily declined. So it's down 95% from 2019. There's been a reduction in the length of stay, certainly. From 2019, it was 8 days. Presently, it's 5.75 days. The quality of the work has improved. The completion rates have improved in majority of areas as well.
Thank you. And looking at the last recommendation from the auditor, it notes in the ministry status update that information about the ministry's use of administrative segregation is available on the publications website. On the publication center. Is this can you help me understand why that was chosen as the best place for this information?
That's just where all of our relevant documents are published. So like all of our provincial policies are publicly available on Publication Center, and then there's a link to our ministry page as well.
Thank you. And with the annual, this is updated annually, correct? Okay. Is this annual updating, is that consistent with best practice? Are there other, I don't have the context for if other jurisdictions, do this weekly or every 3 years?
Yeah, I would say that good practice would anticipate annual reporting seems reasonable and appropriate. Yep.
Thank you. And looking at it, says effective March 2023. So is the next round of annual reporting anticipated next month?
Yes.
Okay.
Yeah.
Thank you so much. I have no further questions on this chapter.
Mr. Nerling, Deputy Chair.
Thank you, Mr. Chair. I have a question for the benefit of the thousands that are watching us this morning. Could you give us a kind of a quick insight into what administrative segregation actually looks like in a real-life example?
Trying to think of the best one I have in mind. I could speak specifically about one. We have had individuals who have repeated disciplinary problems or behavioral management problems. All of their alternatives have been attempted. They may consistently fight with other inmates or refuse to have a cellmate. So what would happen in that instance is they would be assessed using the segregation assessment tool, seeing if it meets the parameters of the risk assessment. And then if it was deemed to be a justified placement, they would be single cell placed. They have 2 hours minimum a day of leisure time. And that does not include if they have a family or in-person non-contact visit, or we also have virtual visiting as an option as well. Or if they had, say, any medical appointments or, speaking with the nurses, that's not included in their leisure time. So they have that. A lot of units have a TV in the cell, so they have that. They can do self-study with Classroom, or if there's any other self-study programming that they could do to occupy themselves during the day. 1 hour of that leisure time must be fresh air as well, should the inmate choose to do so. And so then they're reviewed every day by a correctional facility officer. They have a chat with them, see how they're doing. I'll return to the initial placement. They get assessed by a nurse to see if there's any mental health concerns. Nurses are able to make recommendations about the placement, or even state that it's not a good idea and they don't agree with it. They can add their comments, as well as if there's anything that the staff need to consider. So there's the daily reviews at the seven-day mark. It also gets reviewed by the unit assistant deputy director of programs. They meet with the inmate, they discuss the placement with them. And throughout this process, there is always the consideration, is there a reasonable alternative that became available? So for instance, if an inmate does not do well in this correctional center, is it possible to transfer them to a different one where they would have less strict conditions of confinement? And so then the next formal review is the 14-day, again, continuing on with the daily reviews. And at that point, they would be assessed whether it's safe to remove them from administrative segregation. There is the option of a behavioral management plan. So there would be, specific direction provided to the inmate, structure, rules about the expectations of their conduct. And so in the past year, we have not had an inmate remain on administrative segregation longer than 14 days.
Thank you very much. That was excellent. I appreciate that.
Any further questions, members? Ms. Young?
Thank you. Forgive me, one follow-up question just based off that example you provided. And forgive me if I'm incorrect. I had it in my mind that there were, and I am not an expert in corrections, you may have noticed. However, I had it in my mind that there were 2 different levels of segregation. There was disciplinary and then there was administrative. Is that the case? The example you just gave, you talked about like an inmate potentially, acting out or having bad behavior. Am I totally off base in thinking that there's those two distinct categories of segregation? And if I'm not, can you clarify the causes then for each, as well as whether the processes are the same?
For sure, yeah, the processes are different. So disciplinary segregation is one of sanctions that can be applied if an inmate is found to have committed a disciplinary offense. So our legislation provides for our disciplinary rules, as well as there's also director's rules in each facility. So for administrative segregation, it is based on the safety and security of that individual or the individuals within the facility. The most common reason for administrative segregation is violent or aggressive behavior, and that has stayed consistent throughout the years that we've been tracking. For disciplinary segregation, it has a maximum of 10 days, and it would be a disciplinary sanction as opposed to a strictly safety measure that administrative segregation is.
Okay, thank you.
Not seeing any further questions at this time. Thank you. Thank you for the exchange and the responses on this front. Questions. I'd welcome a motion to concur and note compliance with recommendations 1, 2, 5, 6, and 7. Mr. Gowdy moves. Is that agreed? Agreed. That's carried. I'd welcome a motion that we concur and note progress with respect to recommendation number 3. Ms. Lambert moves. Is that agreed? That's carried. And I would welcome a motion that we concur with recommendation number 4, moved by Mr. Lemeg. Is that agreed? And that's carried. Okay, moving along, I'll kick it back over to the provincial auditor to focus on Chapter 13.
Chapter 13 of our 2022 report, Volume 2, on pages 161 to 165, reports the results of our 4th follow-up audit of management's actions on the recommendations we made in 2011 about community rehabilitation to adult offenders. We made 7 recommendations in our 2011 report. By June 2020, the Ministry of Corrections, Policing and Public Safety implemented 5 of the 7 recommendations, and by August 2022, the Ministry improved its processes and implemented the 2 outstanding recommendations. The Ministry is responsible for the provision of correctional services and programs, including the supervision and rehabilitation of adult offenders in the community. At July 2022, there were approximately 830 adult offenders serving community sentences in the South region, which includes Regina, Swift Current, and Estevan. According to the ministry policies, probation officers are supposed to complete risk assessments and case plans for offenders within 12 weeks of offenders starting their community sentences. That is, 8 weeks to complete the risk assessments and 4 weeks to complete case plans. Probation officers are then to document progress in the case plan every 120 days. We found the ministry now monitors compliance with expected timelines stated in its revised risk assessment and case management policies. It also conducted compliance audits to verify that probation officers completed progress reports for offenders every 120 days. We found that by July 2022, the ministry achieved a province-wide risk assessment completion rate of 78% and a province-wide case plan completion rate for adult offenders of 77%. Every 2 months, the ministry reported on achievement of these targets to senior management and frontline staff, such as its probation officers and their supervisors. Establishing targets and monitoring achievement of timelines set in policies, such as for risk assessments, case plans, and progress reports, can assist the ministry in addressing delays in a timely manner and formally tracking its progress towards reducing offender recidivism. I will pause now for the committee's consideration of this chapter.
Thank you very much for the presentation. I turn it over now to Deputy Minister Larson for brief remarks. Then we open it up for questions.
Thank you, Mr. Chair, and thanks again to the provincial auditor team for the work they've done on this chapter. The ministry agrees that both recommendations are now fully implemented. Thank you.
Thank you. I'll open it up to committee members for questions. Ms. Young.
Thank you very much, and thanks for all the work on this, recognizing I'm coming in at the end of a long outstanding recommendation. Can you remind the committee, looking at this first being made in, I believe it was 2011 in the auditor's reporting, how we got to 2024 in terms of the timeline between the initial recommendations and now why it took us, 13 years to get here?
Good morning. My name is Caroline Graves. I'm the Executive Director of Community Corrections. I can certainly answer that question. There have been a number of changes made throughout the years. Looking back at the initial requirements were to complete the risk assessments and case plans within a shorter time frame. In 2017, we launched a large workload review of the work of probation officers and community youth workers. Resulting from that, we made changes to the policies that require risk assessments to be completed now within 8 weeks and case plans to be completed within 12 weeks, so 4 weeks subsequently to the completion of risk assessments. So that time frame between 2011 and 2024 has really focused on making massive changes in terms of the work that we do and the requirements. The policies have all changed over time, and there'll be continued improvements over time as well.
Thank you. So looking at the 2022 ministry-approved target completion rate for adult offender risk assessments, case plans, progress reports of, I believe, 75% by March this year. Will the ministry achieve that proposed target by March 31?
Overall, we're doing quite well. We won't quite reach the target rate of 75%. In terms of completion rates of risk assessments, we're at a completion rate of 70%. That includes risk assessments completed within policy timelines and some assessments completed slightly outside of timelines. So we're at 70% combining those two. In terms of completion of case plans, we're at 72%. That also includes case plans completed within the timelines and some completed slightly outside of timelines. With progress reports, we continue to try to make improvements. We're right now at a completion rate of 56%. So we're continuing to try to make improvements. We found some of the challenges being that we're continually staffing positions, and we're trying to staff positions as quickly as we can. But that presents a bit of a challenge in some locations, particularly the north. And then another competing demand is we also complete reports for the court so that they're always prioritized. So there's always multiple competing demands in terms of our staff's time. So we continue to look at how do we make improvements to continue to do better and better with our work.
Thank you very much. And my thanks to the staff for all their hard work on this. You mentioned there's some assessments and case plans and progress reports that are completed but slightly outside of. Can you be a bit more specific about what constitutes like slightly outside of? What would be the biggest?
Sure. I don't have the exact numbers with me, but usually when we're looking at slightly outside of timelines, it's usually within about 2 weeks outside of timelines. So it's not an extended period of time. It's a shorter period of time. Most of them are getting done just slightly over the timeline requirement where we're outside.
Thanks. And do you know, I'm trying to think of the clearest way to characterize this, but the most outstanding, like what the longest period of time would be if completed?
I don't have that information with me. I'd certainly be happy to get that for you, though.
Sure. Thank you. And you spoke about some of the just the workload, the challenges that staff face in achieving these targets. And you talked about the different regions in the province. And forgive me, I don't know how many you break it down by. You said at least south and north. Do you have compliance numbers available by region?
I do have the compliance numbers by region. I don't have them with me. I could certainly provide those as well, though.
Thank you. That would be appreciated. And then my last question was going to be around, why why that target completion rate isn't reached? And is it's fair to sum that up based on your comments, just in terms of the staff turnover and administrative burden?
It is largely those things would play into things. Another element that relates, and I can provide some information as it relates to our supervision standards, is that when our clients are in the community, they're not a captive audience. So we rely upon our clients to report as instructed. They don't always do that. So sometimes what happens is things aren't completed in the timeline that we would hope, simply because the clients aren't engaging in supervision. So we do the best we can to try to re-engage in those instances, but that will play an impact sometimes as well.
Thank you. And is that that kind of loss of contact with the client, is that a leading indicator of recidivism, or is that just simply the way it goes?
It just simply is the way it goes. Yeah.
Thanks. And what you talked about the challenges with staffing. Do you have the staffing or the turnover numbers available?
I do. So for our level 9 staff, so our level 9s are probation officers and community youth workers. So the turnover rate with all level 9 supervisions between April 1st of 2023 and December 31st of 2023 is 24%. If we look at people who left community corrections, because some people stay within our system, so within the people who stay within our system people who left community corrections is 22%. So 22% overall. And then in terms of completing this work, we also have level 10 program specialists, and the turnover rate for that group of staff between April 1st, 2023 and December 31st, 2023, looking at people who left community corrections overall, is 13%.
Thank you. And looking kind of year over, I don't know what a relevant time period would be, if it's 2 years, if it's 5 years, is that turnover rate of around 22-24%, is that fairly consistent year over year?
It is. When we look back at the last few years, so for level 9 staff in 21-22, it was 25%. 22-23 was 18. And then, as I mentioned, between April and December of this year, or of 2023, was 22%. When we look at level 10 staff for 21-22 was 12%. 22-23 is 16%. And then 2023 from April to December 31st was 13%. So fairly consistent over time.
Thank you. And last question for me, Mr. Chair. Is recruiting a challenge, or is it an evergreen challenge? Is it increasing? We hear about labor market shortages sometimes in the province, and I'm curious what that kind of regular level of turnover, what it's like on the hiring side.
It is a challenge for sure. In some locations, it's more of a challenge than others, particularly so, as I had mentioned earlier, we have the North region, and as you alluded to, we have South, and we also have Central. So we have South, Central, and North. I'd say in the last few years, recruitment overall has certainly been more challenging. I think not just for us, but across the country. The conversation comes up at the federal, provincial, territorial committee that I sit on. So it's an issue not just here, but everywhere. And then particularly in some locations, so for example, in the North, some areas are more challenging to recruit than others.
Thank you very much.
Any further questions from committee members on this chapter? Not seeing any at this point, I'd welcome a motion that we conclude consideration of Chapter 13. Moved by Mr. Lemeg. All agreed? All right, that's carried. We'll move along now, and I'll turn it over to the provincial auditor to focus on Chapter 14.
Chapter 14 of our 2022 report, Volume 2, on pages 167 to 173, reports on our second follow-up of management's actions on the recommendations we first made in 2018 about the ministry's processes to provide primary medical care to adult inmates in its secure custody correctional facilities. We made 9 recommendations. By July 2020, the ministry had addressed 2 of the 9 recommendations, and by July 2022, the ministry implemented the 7 outstanding recommendations. We found the ministry delivered orientation to its nurse managers and tracked completion of the required training. The orientation covers key content for the provision of medical care in a correctional center, including conflict management, substance abuse, and incident reporting. The ministry also tracked the currency of correctional staff's first aid certifications. We assessed a sample of 30 first aid certifications listed on tracking sheets and found all certifications current. We found the ministry initiated a nurse-to-nurse form to provide inmates critical medical information when inmates transfer between correctional centers. We tested 30 inmate transfers and found the nurse-to-nurse forms completed and promptly received by a nurse at the receiving center for inmates with significant medical conditions. We also found the ministry monitors the use of these forms through medical file audits and identify instances of incomplete forms similar to our testing. The ministry evaluated its provision of primary medical care to inmates through medical file audits and analysis of medical complaints. This can assist correctional centers' medical staff in identifying areas of improvement. Correctional centers track inmate complaints, including medical complaints, in spreadsheets and send them to ministry management quarterly. We found the spreadsheets included the date complaints were received and the date the correctional center director provided a response. We found actions taken to resolve a sample of complaints we tested were reasonable. The ministry also compiles medical file audit results from the 4 correctional centers into a provincial summary and categorizes issues identified through audits into themes. The most common themes identified through medical audits include issues related to mental health and addictions care, dental health, and long wait times for physician care. The audit file summary included comments on resolutions to identified issues. Evaluating the provision of medical care can assist the ministry to determine whether inmates receive care consistent with this policy and help to guide correctional centers' medical staff in identifying areas of improvement. I will pause now for the committee's consideration of this chapter.
Thank you very much for the presentation. Thanks as well to the ministry for all the work on this front, and maybe to the public that might be following. This chapter has already come to this committee. We've had a round of questions on it, and a bunch of work that's been undertaken by the ministry. They've reported back implementation on with respect to the recommendations, so thanks for the work. So this demonstrates sort of the follow-up process of this table, and importantly, the auditor within this process. So I'll kick it over to the Deputy Minister for a very brief remark, and then we'll open up for questions if there are any.
Thank you, Mr. Chair, and we totally agree. We're very pleased to see the 7 recommendations fully implemented. Thank you.
Thank you. Questions from committee members? Ms. Young?
Thank you, Mr. Chair. Morning again. Recognizing it's been, I believe, about 18 months since the recommendations from this audit were implemented, is it still the case that all the original recommendations are still being adhered to?
Good morning. Dean Carey, Executive Director of Offender Services, and yes, they are.
Great, thank you. Can you provide some comment on the current health status of the inmate population and health issues that the nurses often treat?
Certainly. In terms of our inmate population, they present with very similar health issues that you would see in the community. A lot of our inmates are certainly disenfranchised and potentially would have more significant health issues, potentially at times. And I think that, overall, it's an opportunity to have somewhat of a captive audience and to try and address those particular issues. We do a lot of work with the Health Authority and the Ministry of Health in terms of trying to establish opportunities to address, for instance, communicable diseases and some other pieces, just in the advent of further public safety. Because if we can address those things while we have them, then it provides an opportunity once released that it doesn't carry on into the community.
Thank you. And looking at the numbers that were provided in this chapter as it pertains to nurses working in correctional centers, those numbers were from July 2022. And it notes that the total nurses includes both full-time and part-time nurses. Are you able to provide what the current breakdown is, both for staffing levels overall and what the distinction is from full-time or part-time?
So in terms of total nurses, currently in 2024, so this would have been within the last month, we would have 101 working across the facilities. So 16 in Saskatoon, 40 in Regina, 24 at Prince Albert Correctional Center, 21 in Pine Grove. So the 101 total. And then in terms of breaking that down, so in Pine Grove currently we would have 11 full-time positions, 7 are filled. Oh, sorry, 7 are vacant. So there would be part-time people filling in those positions. At Prince Albert Correctional Center, we would have 11 positions and 4 of them are vacant. Saskatoon Correctional Center, again, 11 with 4 vacancies for the permanent full-time. Regina Correctional Center, 17 with no vacancies. And yeah, that would be the 4.
Thank you. So looking at those numbers, obviously there's been some challenges for the healthcare system overall over the past couple of years here in Saskatchewan and elsewhere. Are there challenges in recruiting medical staff for correction centers?
There are always challenges recruiting nurses, and I think to a large degree why we have so many permanent part-time nurses is because it allows them flexibility. Often they work for the Health Authority or they work for Correctional Services Canada, and it gives them the opportunity to choose shifts, pick different opportunities to work. We certainly recognize the challenge of particular nurses, I think, for the most part. So we've tried to make connections with the different colleges of nursing. We ensure that we provide opportunities for internships and practicums within our facilities to give them the opportunity to see what that's like. And then any type of job fair or visiting the colleges or different things, we try to promote ourselves to try to ensure that we have adequate nurses within the facilities.
Thank you, and forgive me if this was canvassed in years past, but is there a target ratio of healthcare staff to inmates?
A targeted ratio.
200 people in a facility, or I'm just pulling numbers out of thin air?
No, that's okay. I know that's certainly in terms of some of the work, I think Caroline Graves mentioned the federal, provincial, territorial committees. So we're fairly consistent as we are with other provinces. I think, for instance, Correctional Services Canada has a better ratio than we would have. But in terms of the actual best practice, I could certainly find that for you.
Yeah, that'd be interesting to hear more about that specifically, if there are targets that the ministry has internally that it's interested in maintaining for its incarcerated populations.
One piece that I think, just to identify, is that many of the other provinces, the Health Authority provides correctional health care. So we're one of a few provinces where we provide our own correctional health care. So we hire our own nurses and we contract medical services. So we just have to think about it in terms of ratios, in terms of comparing apples to apples. But we'll see what we can provide.
Thank you very much. Just a couple more questions on this. Currently, are there wait time standards for inmates in order to access a medical professional?
There certainly are wait times in terms of specific standards across the different. Not that I'm aware of. I know that we certainly continue to explore almost different methods of providing services. So again, one of the discussions with the health authority and looking at some of the evidence-based practices are around virtual care. So, for instance, for psychiatry or in terms of having somebody go out to the emergency room, there are potentially opportunities where we can access psychiatry or doctors virtually in a confidential, confined setting to improve the services, to reduce wait times. So we're currently working at exploring those different opportunities.
Thank you. Do you have any clear numbers in terms of like what a standard or an outstanding wait time would be for somebody needing to access, for an inmate needing to access medical care? What would be typical and what would be an outlier?
So just as an example, so Pine Grove, our women's facility, to see a doctor, a general practitioner, the wait time is 2 to 3 weeks currently.
And are there numbers at like an extreme end of that that the ministry would track in terms of somebody potentially waiting, I don't want to speculate, but months or?
I can just give a quick look here. It would appear that optometry, which is a contracted service, has a longer wait time could be up to 12 months. I know that, for instance, with psychiatry, again, sort of ranging from 2 weeks to 90 days. Again, part of the discussions around the virtual services. For instance, in our northern facilities in Prince Albert, there's longer wait times, for instance, say Regina or Saskatoon, but looking at opportunities to access services in Saskatoon to virtually provide those services in PA are some of the things that we're working on.
Thank you. And moving on to medical complaints, for folks watching at home, can you define a medical complaint? Is it an inmate saying, hey, I didn't like the care I got, or hey, I still have this issue?
Well, yeah, sometimes, sure. Sometimes it's related to the medical service that is provided. The majority of the complaints tend to be around medications. And so one of the challenges is they may have been on certain medications before they come into center, and then doctors prescribe within center, so they may or may not prescribe the same medication as they had in the community. We have lots of issues around diversion. So, for instance, if they're on let's say an opiate agonist therapy or some other medications or attention deficit or some other pieces that have value, so to speak, within center, then if they are caught diverting, especially the warnings, and then if it continues, then the doctor will no longer prescribe the medication, which is never, usually ends up in a complaint or an appeal because they have been taking that medication. And again, medications do serve a purpose. Some other pieces that we're trying to look at in terms of trying to reduce some of those pieces are looking at something like a film, for instance. So if you think about a Listerine strip, so rather than having to take a pill and ensure that it's swallowed properly, if it's just a film that's put on the bottom of their tongue, for instance, it saves everybody time and there's a far less likelihood of diversion. So just different things that we're trying to implement to address some of those pieces.
Interesting, thank you. And then it's noted in this final chapter, the average days of delayed response has dropped, and it provides the numbers for the Regina Correctional Center up to 2022. Do you have those numbers, more current numbers?
So we're talking specifically about the medical complaints or, okay. So dropped, and then the current numbers, so I think the last numbers that you had from 2022 were just January to March, and so there's a number of 63, and when I look at that same time period for 2023, I have 39. So that's a continued trajectory.
Thank you very much.
Any further questions, committee members? None. Not seeing any. I'd welcome a motion to conclude consideration of Chapter 14. Moved by Mr. Harrison. All agreed? That's carried. Turn it over to the auditor to focus on Chapter 8.
Chapter 8 of our 2023 report, Volume 1, on pages 129 to 132, reports our first follow-up audit of management actions on the recommendations we made in 2021 about the Ministry of Corrections, Policing and Public Safety's processes to provide timely financial disaster assistance under the Provincial Disaster Assistance Program, and to seek amounts reimbursable under the Federal Disaster Financial Assistance Arrangements. We made 4 recommendations in 2021, and by January 2023, the Ministry implemented all 4 recommendations. We do want to mention that the responsibility for the Provincial Disaster Assistance Program transferred to the Saskatchewan Public Safety Agency effective April 1st, 2023. At the time our audit work was completed, the program was still under the responsibility of the Ministry of Corrections, Policing and Public Safety. In 2022, the Provincial Disaster Assistance Program received 802 claims. By January 2023, the Ministry documented service standards for how long it expects to take to assess a disaster area designation request and how often it expects staff to monitor the status of disaster assistance restoration work. The Ministry expects staff to assess disaster area designation requests within 14 days and monitor the completion status of disaster assistance restoration work every 2 months. We tested 11 disaster area designation requests and 5 local authority claims for disaster assistance restoration work. For the 2 instances where the Ministry did not meet its service standard, we found the Ministry documented the reasons why it did not meet its service standard and included this information in its periodic progress reports to senior management. The Ministry also periodically analyzed the actual results compared to expectations for its key service standards and reported the results to senior management. We reviewed 3 reports to senior management and found the Ministry analyzed whether it met its key service standards and included the reasons and actions taken to address any issues noted. We found the Ministry met its service standard expectations 67% of the time. In all 3 reports, the Ministry did not meet its service standard expectations for receiving adjuster reports and assessing and paying private property claims. Regular reporting on whether the Ministry is meeting service standards for key activities allows senior management to be aware of potential issues with the Provincial Disaster Assistance Program and take timely action to address these issues, such as working with the contracted adjusters to receive reports more timely. I will pause now for the committee's consideration of this chapter.
Thank you for the presentation. Thank you again for the work on this front, follow-up on this front. I'll turn it over briefly to Deputy Minister Larson, then we'll open up for questions.
Mr. Chair, the Ministry is obviously pleased that the first follow-up audit concluded all recommendations as implemented. Thank you.
Thanks so much again for folks following at home. This chapter has been before this committee. We've had questions and a whole lot of work that's been done on this front. Thanks to the auditors team for their follow-up work. Thank you to the Ministry and all those involved in the work that's been identified. I'll open it up now for questions. Ms. Young.
Thank you very much. Great to see all the recommendations in this report have been implemented as of this audit. Looking back at the past year, can you list for the committee the various events in 23-24 to date that have created claims for the disaster assistance program?
It's Noel McVenna, the Executive Director of the Provincial Disaster Assistance Program. I do have a list of the designations here. However, they are publicly available on the SPSA website under municipal designations. Perhaps I could just summarize. There have been 70 approved designations this year, ranging for things like spring snowstorms, some spring flooding, heavy rain, plow-ins, and tornadoes that occurred over the summer this year.
Thank you very much. And the service standard expectations have been met. Do you have that number available for this year? Sorry if I just missed it.
So for each for the assessment of the designation requests, we're currently averaging 4 days turnaround on that with a stated performance standard of 14 days. We would consider this a relatively quiet year in terms of the program. So in a year with much more volume, the service standard might be adjusted, right?
Thank you. So you said there were, I believe, 70 claims received this year to date?
That's 70 designations for different disasters warranting an application to the program. For individual claims to the program, there's 362 so far this year.
And what's the current backlog for that?
There isn't a current backlog. Actually, we are within standards right now on claims. We're processing in an average of 80 days for a normal private claim. Obviously, a complex structural claim would be another story.
Thank you. So over the past year, then you've been able to maintain that 14-day processing target for claims as expanded upon your last answer.
Yes, so the 14 days is related to the designation. That's effectively the process where a municipality tells us a weather event has happened and we require assistance from the Provincial Disaster Assistance Program. And then the 80 days that I mentioned is our turnaround from once a community is designated and a private claimant sends in their application, we have an adjuster go out, visit, assess the damage, process that report, and issue initial payment to the private claimant. So that's 80 days on a target of 90 days. Is where we're currently processing. And again, we would consider this kind of a below average volume year.
Thank you for that important clarification. So with this year being a bit below average, over say like the past 4 years, I don't know what a relevant window of time would be, has the number of claims, has the trend been increasing year over year, or is it fairly chaotic? Seems like a negative term, but scattered.
I would say that chaotic may be deemed a negative term, but it's probably appropriate in this case. It's very much dependent on the severity of weather events we have and also the location where we hit those weather events hit. So if they hit a population center, obviously that's a lot different than if they hit agricultural land. The impact and number of claims that would result are vastly different.
Thank you. So hearing perhaps there's some eclectic numbers year over year. When did tracking of this begin?
Tracking of which specifically?
In terms of what would be the first year you'd have clear kind of consistent numbers if you want to compare apples to apples, looking at the number of claims year over year?
So number of claims, we would have good data in our database as far back as 2010. Here today, I can speak to certainly within the recent, most recent 5 years, our claim averages have been a little bit lower than say 2014, where a claim number would have been in the thousands. That was obviously we had flooding that hit large population centers in those years. But maybe to give you some context, in the last 3 years. We've had approximately 300 claims and then 900 claims, and then this year again about 362.
It's quite a variance between those 3 years. And sorry, you said there's pretty good data available back to 2010, and that's all available also online publicly on the website?
We don't carry that historical information on the website. We would be able to provide this committee if there's a specific figure, such as claim numbers that you're looking back. We would definitely be able to provide that. But
thank you. And then again, recognizing this is a follow-up. Over the past year for 2023, did the ministry receive any complaints regarding its claims decisions?
So we have not received any formal ombudsman complaints or appeals over the past year. We did have the program being loosely named in a lawsuit among other other parties. However, that was quickly redacted by, so.
Thank you. And is there a process in place evaluating kind of the experience of claimants with the program? Is that something you evaluate in terms of whether there's a positive or a negative experience? Is there a feedback mechanism?
We do obviously have direct interaction between our program advisors and the claimants. We don't have like a follow-up email survey or anything of that nature.
Great.
Thank you. Yeah, any further questions from others around the table? Ms. Young, you've got through your questions. We'll not see any others. Thanks again for the work on these fronts. Chapter 8, I'd welcome a motion to conclude consideration of Chapter 8. Moved by Mr. Gowdy. All agreed? That's carried. Well, listen, I want to thank all the officials, all the leadership of the Ministry of Corrections, Policing and Public Safety for their presence and time here this morning. I want to thank the Auditor's Office for their work on these fronts. And I want to thank all those that have been involved in the work that we've identified here tonight, and all those that are involved in the very important work within this ministry right across the province. Any final words, Deputy Minister Larson, before we break for lunch?
Other than thank you as well, Mr. Chair, thanks to the committee, thank you to the provincial auditor, and thank you to my team and the work they did in preparing our presentation today. Thank you.
Great. Well, thank you so much, everyone. We will have a bit of a recess for lunch, and we'll reconvene at 1 p.m.